Hi, this is RxHelp, advice from a person on the other side of the pharmacy counter. And today I'm not really going to be giving advice because, truthfully, I can't really think of a topic right now off the top of my head, and I want to do another one just to kind of keep things updated. Today I'm actually going to be telling you, basically, this is more of an FYI, this is what it takes to become a pharmacist. I really don't need to explain this to people that are in pharmacy school, but just for people who wonder, what a pharmacist goes through college-wise. So, basically, for anybody who graduated in 2000, so anybody that's under the age of like 35 at the moment, had to have gone through a 6-year program. Casey. Go sit down. I have a visitor for my video. Anyway, back to what I was saying. I'm trying to do this without any cutscenes this time. So anyway, any pharmacist who graduated after 2000 or is approximately younger than the age of 35 this year had to have gone through a 6-year pharmacy program and has their Doctor of Pharmacy or PharmD. What happens is basically the first 2 years that you're in college, you go through what's called pre-pharmacy prerequisites, and these are basically any kind of general education requirements for the school that they went to, and then they have to take all your basic science courses, and then of course organic chemistry. Some places require physics, other places may require a microbiology course before you enter the other 4 years, but basically you're going to be taking any basic science things that you need to build upon once you get into the last 4 years. So after you complete your prerequisites, then you move on to what are called the professional years. At pharmacy schools, we always refer to them as P1, P2, P3, and P4 years. And basically, a P1 is usually, if they're doing it the school traditionally, they're juniors in college, but pharmacy students are kind of their own breed, just like med students. So we refer to ourselves as P1s when we hit our 3rd year of college, and we've officially entered the professional program. In your P1 year, it depends on the school you go to, but most of the time you learn basic pharmacy type of things, so like medicinal chemistry, anatomy and physiology will sometimes be covered, any kind of other basic sciences that you'd need to cover before moving on to learning about the drugs and disease states that go with them. And so that's what you'll do in your first year. This is also where students typically learn to how to talk to and counsel patients on medications. They'll learn different techniques on how to deal with patients who can't hear well, patients who are angry, patients who want to get done as quick as possible. Basically, they learn to deal with different situations so that by the time you get out of pharmacy school, 4 years later, you can counsel a patient very easily. So that's basically what you do in your P1 year. P2 and P3 years is usually where you have what's called pharmacotherapeutics class. This is basically what teaches us to be pharmacists. This is where it depends on the school that you're going to. Some will split it up by disease state, some will split it up by class of drugs. The way that my school did it was we covered disease state topics at a time. So first we did what was called our self-care module, and this is basically cough, cold, flu, over-the-counter, how to treat a fever, when it's a bad fever versus when you can tell the patient to treat on their own. those kind of things, because it's a really easy topic and it's a really easy way for us to start. Then we moved on through infectious diseases, gastrointestinal things, miscellaneous things like osteoarthritis, pulmonary diseases, cardio, nephrology, endocrine, diabetes, women's health, central nervous system diseases. We did a lot of different things, and we based it on disease states or kind of like organ system type of thing. Other people will split it up based on class of drugs, so these are all heart medications, so we're going to learn how they all work, like that kind of thing. But basically it consists of two different things. First, you learn about the pharmacology of the drugs, so basically the chemistry behind them, what makes them work the way they work, how they react with everything in the body, why they cause certain side effects, things like that. And then we go into learning about the therapeutics. So pharmacotherapeutics. Therapeutics is basically how we use it in a patient, dosages we use it, what we would tell the patient if they were starting on it, counseling points to hit, little like practical things you would tell a person, and things that are generally easy to remember for most students, although there are students that like pharmacology better, of course. But besides those take up the chunk of your professional years. But besides those, you'll also have students will also typically continue to practice those counseling skills. They'll have labs. We always call them pharmaceutical care lab. Some people call them like practice labs, mock counseling labs. It's basically a practical setting that we can practice how to counsel. We also practiced where to look up information about any kind of drug questions, what kind of sources were reliable versus which weren't, things like that. Some people will have complementary medicine. Some people take a course about veterinary medicine. There's all different kinds of like pharmacy electives. I personally took what was called drugs of abuse, and then at my school we were also allowed to substitute upperclassmen courses, so not 100 level courses for anything. So I took a bunch of psychiatric courses because I really like psychiatric medicine, so I took like psychopathology, things like that. But yeah, so basically you go through your P1 through P3 year in the classroom. P4 year is where it gets interesting, and that's where I am right now. P4 year consists of clinical rotations, where for a couple weeks at a time, the student will go out to different settings, basically doing what a pharmacist does, learning what they do. And it's always required to do a community rotation, some kind of hospital rotation, and some kind of what's called ambulatory care or clinic setting rotation. Some schools also require you to split the hospital between being in the inpatient or in the in-hospital pharmacy and being on the floor doing clinical work with the internal medicine team. And then you usually get electives that you like to pick. So my load was I had to do the 4 required community, the hospital pharmacy, the internal medicine rotation, and the ambulatory care or clinic rotation. And then my 3 electives that I ended up getting were a psychiatric rotation, an infectious disease rotation, and a Coumadin clinic rotation. So, but people can do a variety of things. There are people that do elective research, like in a laboratory, doing bench research. There's people who do clinical research. There's people that do rotations with the FDA. People go out to the Southwest to work with the Indian Health Services. Our school allows people to go to Peru and Africa, too, as a rotation to kind of do alternative medicine and Doctors Without Borders type of thing. There's all different types of elective rotations that they do, but it's during this last year that we take what we learned in the classroom and learn how to use it in real life. And this is what takes us from being a textbook pharmacist to being a real-life, practical, practicing pharmacist. And so by the time we get to our P4 year, we're pretty knowledgeable about drugs, especially if we're used to, if we work at a pharmacy, we usually know specific drugs, know how to counsel patients. By the time we finish school, so from the time that we finish our P3 year to the time we graduate, we go from being students to being professionals. And it's amazing how much you learn in that last year. You learn a lot, which is why I feel comfortable making these kind of videos and giving people advice, because I feel confident in my abilities as a up-and-coming pharmacist. I've completed 5 of my 7 rotations that I had to do now, and so it's a really good feeling to be almost done. But that's a basic, that gives you a basic idea of what students go through to become pharmacists. It's a 6-year process. There are some exceptions. Some schools will do a fast track where you'll just go year-round and you'll be done 5 years. There's talk of adding a 7th year to programs, but for the most part, it's a 6-year program, and the students will end up with their Doctor of Pharmacy. And then they can go on to either just working in your local CVS or Rite Aid or independent shop. They can open their own pharmacy. Some students will choose to go to graduate school so they can get their PhD, especially if they like bench research and the pharmacology aspect of everything. What's becoming more popular is what's called pharmacy practice residencies, or just pharmacy residencies in general. And that basically gives you an extra year of more intense practical training. Generally, if you do a pharmacy practice residency, you're looking to work in a hospital in a clinical setting, whereas if you do a community residency, you're looking to work more in a community setting, but it basically gives you an extra year to kind of just solidify what you learned in your rotational year as a licensed pharmacist. So that's just a brief overview. If anybody wants to know anything else, if there are high school students that are looking towards pharmacy and have any questions, just drop me a comment or a message, anything like that. If there's any more questions about the programs in general, just let me know. I can help you out, because obviously I've been there. But yeah, so that's just a basic overview, and I just kind of felt like making this video. Again, if anybody has any questions, heard anything in the news, and wants to know if it's accurate or not, just drop me a message or a comment with any questions you have. Don't be afraid to ask them. If it's too much of a specific counseling question, I'll let you know, and I'll let you know how to find the answer. Since, again, I'm not a licensed pharmacist yet, so I can't technically counsel. I can just give advice. But yeah, just if you have any questions, let me know, and I will be more than glad to help you. Okay, I will talk to you guys next time. Bye!